Welcome to our annual scholarship luncheon. This is perhaps the best event we host at the School of Public Health. I would especially like to thank the parents of our scholarship recipients who are here with us today. Thank you very, very much for joining us. So this is a chance for us to recognize and honor some of our most outstanding students who are rapidly becoming the next generation of public health scholars and leaders. This is also an occasion to step back and acknowledge the commitment of our donors to the education of that next generation of scholars and leaders. Each scholarship, and there are now 21, represents a passionate belief in public health education and the UAB School of Public Health over any number of other opportunities people have an opportunity to invest in. We are all deeply grateful for that commitment and belief in the future of public health and the future of our students. The other very important aspect of these scholarships that we sometimes forget is that for many students, these scholarships make it possible to get a graduate degree in public health and to use that degree to contribute amazing public health work to our many communities. I've personally had the pleasure to watch students come to UAB because of a scholarship and simply hit it out of the ballpark. So to our donors, thank you, thank you, thank you. Scholarships are certainly nothing new, and among schools of public health, UAB is very fortunate to have so many scholarships to support our students, and that number keeps growing. We are here today in large part because of one of the many visions of our founding dean, Bill Bridgers, who had for the school. Bill wanted to create a large enough endowment so that every student at the UAB School of Public Health would have a full tuition scholarship. We're not there yet, but thanks to Bill, that vision, we're getting remarkably close. And finally, we are here. We have our first undergraduate scholarship recipient who's here with us. We launched an undergraduate major in public health last fall, and in that short amount of time, we now have as many entering undergraduate students as we do master's students. And with these new students has come a new type of energy and excitement that is transforming the culture of the school in many very positive ways.
Thank you. This is a great honor. And the first thing I'd like to say is Max, if you're ever looking, I would like to hire you as my PR because he's taken my 3 accomplishments and made it sound like a Lifetime Achievement Award. And it felt really good. Thank you. But when I first really learned about being selected as the Alumnus of the Year, I was really grateful, really thought that they had made a mistake for the other Abdul Rasulnia that went to the School of Public Health. But really and truly, as I've gone through the School of Public Health here, I've come to know some very smart, caring, and supportive people. Namely, I would like to thank Dr. Pete Ginter and Dr. Jack Duncan. They were my first mentors when I arrived here at the School of Public Health. They reluctantly passed me through my dissertation and my PhD and have been continually supporting my public health career. They've even allowed me to publish on their textbooks, which continue to be bestsellers, I think, on Amazon. When I graduated from the School of Public Health, I didn't really know what I wanted to do with my degree. I really wanted to apply it in the private sector, and that's something I've always wanted to pursue. And that's kind of where I met my wife and had a chance to work with her in one of her first startups. But really, thanks to the advice and support of my mentors here, I've been really lucky to apply what I've learned successfully to start a new business with my PAC Health buddies over there, and really with a lot of the like-minded people in public health entrepreneurship. So to the current students of the School of Public Health, I encourage you to utilize a rich network of your fellow classmates, and especially your professors as you pursue your careers. They're here to help you, they're here to support you, and even do business with you. Finally, I wanted to thank my parents and my lovely wife for all their continuous support. They've always listened to my crazy ideas and encouraged me to go after them. So until I fail, I'll definitely take the encouragement. So thank you again for the recognition, Dean Michael, my mentors Pete and Jack, and all the advisors here at the School of Public Health for your continuous support. Thank you. Great honor.
Before I comment, I would like to say thank you to everyone for being here today, and also for the Scholarship Committee Luncheon for making this possible. Thank you, Dean Max Michael. Thank you, our faculty, staff, our alumni. thank you all for being here today. A big congratulations to you, Dr. Mazzi. Thank you for inspiring us. I can stand here before you today because of the generous contributions of friends, alumni, and colleagues of the One Navea Scholarship Endowment Scholarship. Dr. Navea's family is here. I want to say thank you to you personally. My fellow recipients have come from all over the world and all around the United States. I am from Nigeria. My beloved country is one of the largest oil-producing nations in the world, yet our health service performance has consistently been ranked one of the worst by the World Health Organization. Unlike most girls who grew up in a typical Nigerian home, I was raised to be aware of these issues. I was 11 years old when my father began to manage the day-to-day activities of a small community hospital in my hometown, Abeokuta. I watched my father enact policies to encourage the poor to seek better health care. Heartbreakingly, I also watched them struggle to get enough resources to fund the hospital. There were many who needed care. There was so little to provide this care for them. My father never gave up. He was genuinely interested and wanted everyone to have access to good quality health care. This was how I was inspired to pursue public health. And this is why I am in healthcare organization and policy. I believe that with the right policies in place, we can make a difference in Nigeria. It's really one thing to want to make a difference and have these dreams, these goals, these aspirations. It's another thing to be in an environment where these goals can be nurtured and brought to life. I can tell you that here at the UAB School of Public Health, we are blessed with outstanding faculty and mentors who would not only equip us and prepare us to face the toughest challenges of the world, but also inspired us to dream and think beyond what we know. Some of my professors out here have been extremely blessed to be in class with Dr. Sen. Dr. Kilgore is my research advisor currently, and I can tell you that they are one of the best people. When people ask me what I intend to do with my doctoral degree, I have realized that they are asking me whether or not I intend to return to Nigeria. I tell them that I want to change the face of healthcare in my country. Well, they tell me that the problems, we have a lot, I know that, but I also tell them that this is why I'm at UAB. And here is why. Nigeria, as you may already know, was recently declared Ebola-free. When the first case was diagnosed about 3 months ago, many believed that we will be one of the worst hit nations in the world. Why is that? Nigeria is only twice the size of California, but we have more than half the population of the United States. So if the Ebola was not brought in control as fast as it was, we would probably have had an epidemic. Luckily, we are Ebola-free, and people have asked me, what did Nigeria do differently from, say, countries like Liberia and Sierra Leone, who are still struggling to keep Ebola under check? I am not an Ebola expert. Dr. Craig Wilson gave a wonderful speech the other day. I'm sure you can ask him, but I can tell you that UAB got the right man for the job. The head of our Ebola emergency operation is a 2010 graduate from our school. Dr. Faisal Shuaib was here at UAB and was mentored by Dr. Jolly here, and he credits his knowledge at UAB for his ability to be able to keep Ebola under check in Nigeria. This is why the work of UAB is very important. And this is why your continued support, friends, colleagues, and alumni, is necessary. When you support us, you're not only impacting our lives, but you're changing the world. Knowing I've been awarded this scholarship, I really feel proud, but also I feel even more obliged to want to do more and go back and make a difference. Like Dr. Schweib, my fellow Nigerian, I want to make a big impact in the healthcare system. I want to make sure that hospitals have the basic necessities to address the issues that we have. And I hope I'm able to do this, and I believe that with the mentorship that I have, that I'm receiving at UAB, I will be able to do this. As I wrap this up, I want to remind you again that every contribution that you make is a contribution towards changing the world. On behalf of my colleagues who have received a named scholarship, we say thank you so much for your generosity. We hope you continue to support us. Lastly, my sincere appreciation to Mona McCarthy for giving me the opportunity to stand before you here today. Thank you all for listening.
I hope you all recognize and feel the same way I do, that this is by far and away one of the most extraordinary events that the School of Public Health does. It is a joy to watch the size of this grow, the number of scholarships grow, the number of recipients grow, and the kinds of things that these young men and women are going to do is just amazing.